Dr. Richard Palacios, who was in charge until a few days ago of the implementation of strategies for testing, tracking, and sustainable selective isolation, the management of statistics and evolution of the COVID-19 on the island, indicated that part of his resignation is due to the decision of the national government to allow the entry of travelers to the island without the COVID test.
The government issued a resolution in which it says that since the number of cases increased by more than 1,000 per 100 inhabitants, we were already highly affected at risk. Then they said the tests are no longer necessary to enter, and they left the airport open, a decision with which I do not agree, because it was said at the beginning that the only way to regulate it was to do the price tests to decrease the level of spread of the virus. So we have to control what comes in to the island, because the travelers comes in without the test. We are no longer doing that. We are increasing the chances that this will continue to worsen on our island. We are seeing that the most affected are our elderly. Therefore, with that aspect, I did not agree, and there are other circumstances.
Palacios stated that the COVID situation in the archipelago can be controlled if the national government understands that the geographical conditions and health deficits that the island faces.
I think we are like a neighborhood in Bogota. Our island is easily controllable, and I think we could use our island as a model of control and prevention, but those policies have to be geared from the national level.
Finally, Palacios specified that the management that Hermetic IPS is giving to the departmental hospital and the resources for the attention of the COVID has not been the most optimal ones, due to the fact that to this day they have the same number of medical personnel since the beginning of the pandemic.
Regarding the human resources, they should be motivated and reinforced. We have had problems of lack of payment, a diminished number of human resources because we did not get more personnel when the demand began to increase. There is a lot of stress that is managed among the personnel of direct attention to COVID patients. 7 months have passed and it is the same personnel with whom we began, and these cases have increased, but the attention and care has not been modified. The workers are tired and stressed, which led to conflict with the operators' health personnel.
So far, the departmental government has not announced whether there will be a new COVID-19 manager.